formation and narrowed disc. So this is otherwise called as lumbar spondylosis or the osteoarthrosis of the spine. Normal vertebrae, spine. Lumbar spondylosis, bones for formation, intervertebral normal intervertebral disc, narrowed disc. So with this single slide, we can identify almost all type of the neurospinal disorders. So this is a normal disc. It's a degenerated disc. Second one is a degenerated disc. It's a bulging of the disc. Then fourth, herniated disc. This is always called as IBDP. In IBDP, actually there is no slipping. That name is also a misnomer, but only herniation. So that herniation is called IBDP, not any slipping. So this is IBDP, herniated disc. Thinning of the disc. Then disc degeneration with the osteophyte formation. That is lumbar spondylosis. Disc degeneration with the osteophyte formation. So with a single slide, we can identify majority of disc problems. So this is an X-ray of the typical lumbar spondylosis. Bones formation. Then what is spondylolisthesis? Spondylolisthesis, that is anterior or posterior displacement of a vertebra or the vertebral column in relation to the vertebral kingdom. And we have two important rubrics in the multi-therapeutic for this condition. Spondylolisthesis is also nowadays very common. It's always it's actually the spondylolisthesis, anterior or posterior displacement that results in the nerve compression. So that is spondylolisthesis. So the two important rubrics in the chapter, that is in the chapter back disc syndrome and back dislocation. These are the two important rubrics for the spondylolisthesis in Murphy's reference cases. Murphy disc syndrome and dislocation. That's in the chapter back. So this one of the spondylolisthesis case recently treated in our IPD. That's still under our treatment. So only the age is only 47. And we took the rubric back disc syndrome, slipped or ruptured vertebrae. So we took the rubric in Murphy's repertoire without some good polypus remedies are there. Back disc syndrome, slipped or ruptured vertebrae, extremities pain lower limb sciatica left, back pain lying back on amelioration, mouth case with Gerardis air open and Gerardis syphilis. It's a mathematical prescription because a lot of degenerative changes at the age of 40 to 47. So these are the remedies, Calicar, post plus ligature, etc. We have started the remedy, Calicar, which is a good improvement to the pain, but I'm afraid that it is not possible to have this dislocate. It should be surgically corrected. But we can correct the disability, the pain and other pain. So this is another case of 35 years. Always remember the age group. It's 35 years. The presenting complaint of the patient is pain in the lumbosacral region, otherwise since 2 months. And I am presenting this type of cases not to say that we have done some wonderful things, but we are to have a methodology of the rubric selection, then the observation after the medication, only for that. So pain in the lumbosacral region aggravates since 2 months, elevation of walking and standing aggravates by, so ambulance by lying on sides. The 4 years back, the pain in the lumbosacral region on turning in bed. So what will be the diagnosis? Suddenly on turning in the bed or taking something from the floor? IBDP is the diagnosis. Suddenly on turning from bed or taking something from the floor. So took allopathic treatment with a transient relief. Numbness appeared in lower limbs, no touch sensation and no desire for stool. Remember, these are all the symptoms of the disease symptoms. I think it is better not to take for the rubric selection. So no desire for stool, they are diagnosed as severe IBDP at L4, L5 and L5S1 and advised surgery. This case is actually posted for surgery. And in the past history, the patient might have recommended tonsillitis, UT and chickenpox and the mental journals decided to be alone, irritability during pain, anger easily, and homeopaths have to take a lot of things like the mental journals and physical journals in addition to the particular components. Otherwise, we will never get the result prescribed based only on the basis of the pathology. So chili patients bathing in warm water, appetite decreased, easy satiety, desire for chilies and pickles, hard insufficient stool, offensive perspiration, dreams of falling from height. And we should include the mental journals, physical journals and along with these particulars. Otherwise it is very difficult to get the desired result in homeopathy. So dreams of falling from height and particulars, headache from exposure to sun, eye strain and in crowd, emptiness not ameliorated by eating. This is also a good symptom. Emptiness not ameliorated by eating. Cramps from cold and white coat at the time. Another physical examination, that is SLR is positive below 40 on both sides. PSLR is also positive below 40 on both sides. Then X-ray degeneration and space reduction between L4, L5 and L5, S1. MRI, posterior and posterolateral disc prolapse at L4, L5 causing thecal sac and L5 root compression. Posterior disc bulge at L5, S1 with minimal thecal compression, and it's a case of, always remember, this case of spinal canal stenosis. That's why they posted for surgery. Spinal canal stenosis at L5. And we took this the following rubrics: might be company aversion to, stomach appetite, easy satiety, stomach contain things, sleep, dreams, falling from high places. The sleep symptoms are very important because we don't know what we are doing during sleep. Perspiration, odor offensive, stomach emptiness, eating, not amyloids. Stomach emptiness, eating, not amyloids. Head pain, some from exposure to, back pain, lumbar, walking while, and back pain, standing while. And the result, sulfur 16/7, sepia, lycopodium, puja are the main remedies. And the PDF. PDF means, that differentiate the medicine. Get angered easily, cramps from cold, chilly patient. And basis of selection, offensive perspiration, mental picture of the patient, and particular modality that's pointed to sepia. So the prescription, that's more important than the case and the inference. So on 28th land, we have prescribed sepia 200 and can walk with the less pain, other symptoms persist, can walk but with pain. And we have prescribed the potency, that is to sepia 1 and after 4 months again the pain started, then we have prescribed the remedy sepia 1. Now the patient has pain after prolonged walking and exertion only. So the inference. And we have verified this in several patients of the neurospinal disorders in our OPD, in our OPD and IPD. The pain is not relieved within a week. After 2 weeks, she could walk but with the pain and intensity reduced after sepia 1. Intensity reduced after sepia 1. After 1 month, she could stand without pain. And remember, this case is actually posted for surgery. So spinal canal stenosis. After 1 month, she could stand without pain. And after 6 months, pain comes only on long walking as if she exerted much. And we have verified this potency. Potency is more important in this case because in almost all type of the neurospinal disorders, the high potency offers best result both in acute and chronic. The neurospinal system controlled by higher center, just verify in your private practice or in clinic and compare with the lower potency. We have verified this in several patients. In neurospinal disorders, even in acute or chronic, it's better to prescribe high potency. Acute means for a sprain or for an acute pain. It's better to prescribe high potency that offers best result than the lower potency, except in the case of the remedy Lecanandus. Lecanandus 30 is also acting very well. That's especially in the stiff neck and for the right. So just verify in your practice, that's all. So the need of the physical examination. Need of the physical examination, that is very, very important. The rheumatological disorders and especially in the case of the neurospinal disorders. So I will explain with some of the important rubrics. So back pain after delivery. We are getting lot of cases of the back pain after delivery. We concentrate on the lumbar region. Back pain, lumbar region, delivery after. The remedy is Kali carbonicum. Pain in the lumbar region after delivery. The remedy Kali carbonicum. And after difficult delivery, the remedy is Napsomicum. Then lameness during. Lameness after this in the lumbar region after delivery, the remedy Napsomicum. And during causticum and calica. So pain in the back, lumbar region after delivery, the remedy is calicarbonicum. After difficult delivery, Napsomicum. Now just to see what happened in the sacral region. The remedy is phosphorus. Pain in the sacral region after delivery. The most important remedy that offers best result is phosphorus. So which is the best remedy for after cesarean section? And after LSCS the patient, usually they have pain in the sacral region. The best remedy, that is from our own literature itself. The remedy, so 3 months remedy also. The local back pain sacral region, instrumental delivery after. The remedy is hypericum. Because of the lumbar function. You have to give very high potency of hypericum. Hypericum 1 more time. So back pain, sacral region after LSCS. So the pain is only on the sacral region, the remedy phosphorus. So after LSCS, the remedy is hypericum. So that is the difference after typical delivery and during then sacral region after LSCS. So what about the pain after pain in the coccyx after delivery? Hypericum and tarantula are the remedies. That is the back pain. Coccyx. Delivery after hypericum and tarantula are the remedies. In that case, Kalikar will not do advantage. Similarly, the pain is on the extremities. The remedies are colophyllum and rhododendron. Extremities pain delivery after. Then extremities pain in the hip after delivery. The remedies again hypericum. Then after the delivery, because that may result some injury to the sacroiliac region, the remedy again sympathy. You got the point? So back pain from lifting. Suppose a porter or a weightlifter comes to you with pain after lifting. And we have a rubric in this chapter that is generalities carrying. There are 2 rubrics for the head load workers. Pain from lifting. That is generalities carrying back on, putting weight on the back, the remedy is aluminum. Putting weight on the head, the main remedy is calcareous. Rustos is a very good remedy for sprain, but it will not act in all places. So just verify in your private practice. So suppose the pain after the sacral region after lifting, the remedies are calcarea, pulsatilla, Rustos and sanguinaria. Back pain sacral region, lifting weight after. Then back pain in the lumbar region, calcarea, naxomica, sanguinaria, staphylococcus after lifting. If it is only because of some weightlifting spine, the remedy magnesium muriatic. In that case, hypericum will not act. Magnesia muriatic. And hip sprain from weightlifting. The remedy is Rustos. Stability is hip sprain. Hip pain sprain from that. The remedy is Rustos. Suppose it is a fall in the lumbar region. That is back pain, lumbar pain, lumbar region. The remedy arnica and rota. Pain in the lumbar region after a fall. But it is on the sacral region, the remedy is molecule. The remedy is Karika. Molecule, the remedy Karika. So if the fall is on the coccyx, the remedy again hypericum and silesia. Sciatica. After a fall, the remedies are arnica, hypericum and rota. That is in the chapter extremities. Pain lower limb sciatica, fall after. The remedy arnica, hypericum and rota. So my point, the remedies will change entirely based on the location. So we should be very careful on the physical examination. So physical examination is highly unavoidable in the case of the rheumatological disorders and neurospinal disorders. Rustos is a good remedy for sprain. But which remedy will prescribe for the sprain of ankles? Suppose falling from neck vessel. Torsion is for the remote effect of sprain. Natural spraining easily. the best remedy for spraying the angles. We should be location specific in prescription, then we will get faster result. We have to give immediate relief to the pain of the patient in the case of acute disease. So homeopathy is better than allopathy in the management of acute diseases, but not acute emergency, like a traffic accident, etc. Then we have to put on the ICU or some other things. But in the management of the acute diseases, homeopathy is far better than. But our prescription should be very correct and apt. Otherwise, we will never get the reset result. So the remedy in that case is that is the extremities, pain, angles. The main remedy is Letamol. Letamol is the best remedy. So it is not now indicated in that case. So just verify this in your practice or clinical practice. You can identify the result. So physical examinations are unavoidable in the rheumatological disorders and neurospinal disorders. Lighting usually a short thing, especially in the morning session, a lot of cases and other things. So just watch this beautiful presentation.